laboratory service provision is relevant in treatment. Major, what we do is diagnostic, to give diagnosis of what actually is happening to the patient. We are in the central lab complex. Complex in the sense that we have other units that make up the Korle Bu Teaching Hospital Central Laboratory. We have the client service unit, the clinical chemistry unit, we have the microbiology unit divided into bacteriology and parasitology labs. Then we have the hematology. So where we are talking right now, we are in the immunology unit where we do molecular testing. This system that you see is Cobas 6800, which actually work with the principle on molecular technology. So this system actually was designed to do COVID testing, but other tests have been added onto it. And some of these tests are HIV testing. Then we have the early infant diagnostic testing, that is children with HIV infection. We do other testing like syphilis using the same technology and other infectious diseases. We have the hematology where we do full blood count, we do ESR, malaria testing, we do sickling testing, then we do HB electrophoresis to confirm whether somebody is sickle cell SS, SC, AA, AS. Then we have the chemistry unit where we do the general chemistry in the blood. So tests like liver function tests, tests like kidney function tests if somebody is suffering from renal condition or kidney disease. Then we do lipids, telling the levels of cholesterol and other tests falling under the lipid profile. Then we do fasting blood glucose. Then we have the uric acid. Then we have other miscellaneous tests, wide range of them, which falls under the chemistry testing. Then you have the tumor markers. One of them is the PSA, like we the men. Then we have alpha-fetoprotein. We have the reproductive hormones. Then other tests which falls under chemistry. Then another important test that falls in the chemistry is the thyroid function test, which we call the TFT. Then we have the microbiology department, which I told you we do bacteriology. So in case of infection, we do something called blood culture and sensitivity, where we want to find out the causative organism or the bacteria which is causing that infection. Then the parasitology unit, we have a place because we do the stool RE, the stool routine examination and urine routine examination. Here we want to find out the chemical levels in the urine, and if there is any bacteria, we do culture and sensitivity. Sensitivity in the sense that we want to know that drugs that can actually combat the causative organism or bacteria.
I've been using Korle Bu Central Lab for the past 2 years, and the reason being is it runs a 24-hour system whereby anytime you come, they will attend to you and give you a date for you to come for your result. Once they give the date and you come, they will give you your result on that day. And furthermore, if the doctors even want preliminary results, even ahead of the date you've been given, the Central Lab can still assist you even with those results before the final due date.
I've been using Central Lab for about 2 months now. They are convenient and fast with the results. That is mainly it. Those who handle us, they are polite. They are polite, making sure that we understand what we are doing and giving us the steps.
The labs are well equipped to handle the numerous cases that come into the hospital. Big equipment, highly sophisticated, modern ultra equipment, that we find here. And we have personnel in abundance. We can count of about 270, between 270 and 300 biomedical scientists. In the main central lab, we have labs at the Obs and Gynae, maternity lab, the blood bank that you see there. Then we have the child health. Then we have the infectious disease center, which we call fevers unit. Our personnel are there. Then we have the chest lab, handling chest infections, TB, culture, and the rest. Then we have the polyclinic. You know, polyclinic falls under Korle Bu Teaching Hospital. The management of the hospital, in their own wisdom, has a PPP. That's a partnership arrangement with the A&E lab. Our personnel are working there under the same central lab management. So the place is fully equipped to handle the number of cases that come here. When you talk of standards, the laboratories in Korle Bu Teaching Hospital, especially the central lab, is accredited. American Association Laboratory Accreditation, ATWLE. We have ascribed to that body and they accredited this place.
So I'll recommend Korle Bu Central Laboratory because they are convenient, they are reliable, and also in terms of payments, they are affordable. You can even use your NHIS to help you with your labs.
Well, somebody may say it's congested because it's a nice place everybody wants to come. But irrespective of how congested it is, even when you come, they attend to you promptly. They'll give you your bottles to go and take your samples. You'll bring it, you do your payment, then they give you a due date. And once you are given the due date, your result is also ready. So it's a good thing, and I recommend everybody to come to Korle Bu Central Lab for their lab tests.
With the opportunities given to us in our various capacities to serve as lab scientists, technicians, and as a laboratory manager, we want to say thank you, Korle Bu.
Thank you, Korle Bu.